Hi, I'm Dr. Ian Johnston, the Chief Medical Information Officer at Chatham-Kent Health Alliance. Many of you have now completed your Cerner training. Our go-live date is coming up quickly. It's November the 1st. Although the training in general has gone well and has been very good quality, I'm sure many of you are wondering whether you'll be ready to manage in a live environment once November the 1st comes around. Like many things, when it comes to getting comfortable with a system like Cerner, there's really no substitute for getting into the system, playing around with it, getting your hands dirty, running some scenarios, trying a few different things. In this way, one will be much more comfortable once go live day arrives. It's for this reason that we have provided a learning environment that we call the Cerner Sandbox, which will give you a safe environment to try the system out. The Sandbox has virtually all of the features that are present in the live environment. Interestingly, one of the more difficult pieces of the Sandbox is actually locating it and logging into it. So I thought we should start this video series by going over these steps. If we refer to the email that accompanied this video, I pasted in a few important pieces, and one of them is a link to the Sandbox. What you see here is not the email, but is a different document which contains the link to Cerner. The key thing to remember is that it's best to do this outside of the hospital environment. And one could simply click on this link and would be taken to the Cerner site. But it works better if we do it outside of the hospital environment. So what we recommend that you do is to copy this elsewhere. It's a simple process. Highlight the link, right click and copy. Once that is done, move outside of the hospital environment. So go to any browser that you prefer. I tend to use Chrome. And then we copy the link into the address bar, press return, and away we go. Now, this is a new sign-in page for many of you. The credentials that we use are exactly the same as the credentials that we use to sign into Citrix. My username is iJohnston, my password is whatever it is. We press log on and away we go. This next page is a filler page. Click on the training environment icons and we see all of the available training environments. We see PowerChart, which is the environment that we use for most inpatient applications with the exception of the OR. We have FirstNet, which is the application that is generally used in the emergency room. We have FetalLink, which is the application which is used on maternal newborn. Since most of us will be doing our work as in an inpatient environment, I'm going to focus on PowerChart in this video series. We have PowerChart with and without Dragon, and for argument's sake I will choose the PowerChart with Dragon. We'll double click, wait a little bit, and we see a couple of things. First, we see the Dragon sign-on page, and most likely you will automatically be signed into Dragon, and then we see the Cerner sign-in page. Now, if people want their very own sign-in, one can ask Medical Affairs and they will arrange that. Alternatively, I've included in the email a PDF that lists out a number of generic usernames that anyone can use. A common one that we use to access a hospitalist environment is what we have printed here, PhysHosp, PhysHosp 142. And for all of these training domains, the password is train with a capital T 123. Press OK, and one will find oneself on a page similar to this. Depending on how you sign in, you may find yourself on a blank provider handoff page. Some sign-in credentials will take you to a blank ambulatory organizer page. Neither of them are very useful without any patients in it. Our next video will talk about how to populate your chart with patients once you've successfully signed in.